Fresh concerns over the health and well-being of detained IPOB leader Nnamdi Kanu as his legal team petitions the World Medical Association, accusing Nigerian authorities of medical neglect and possible cover-up. If you have taken a look at my previous video, I published a letter written by Nnamdi Kanu through his counsel or his legal team to the Nigerian Medical Association. Now, they have decided to take it up a notch by writing to the World Medical Association. The petition, dated October 3rd, 2025, and signed by Kanu'S international counsel Bruce Fein, was addressed to World Medical Association President Dr. Jacqueline Kitulu and copied to several Nigerian institutions, including the Federal High Court in Abuja, the Department of State Services (DSS), the Medical and Dental Council of Nigeria, and the Nigerian Medical Association. In the detailed letter, Kanu alleged that his health had deteriorated severely due to what he described as inadequate medical attention while in DSS custody. He claimed to have been detained in solitary confinement for more than 4 years without trial since his arrest in Nairobi, Kenya in June of 2021. The letter warned that the situation had reached a life-threatening threshold and appealed to the WMA to intervene through the NMA to ensure he receives proper medical care, free from intimidation or interference. Now, Kanu'S counsel also requested a review of what he called irregularities in his medical records while in custody and sought protection for independent medical professionals attending to him. If you take a look at my previous videos, I had explained all of this in detail, right? Kanu traced the beginning of his health troubles to his alleged abduction and detention in Nairobi, where he says he was denied food, water, and medication for several days. Now, according to the petition, his blood pressure soared dangerously high before he was given emergency medication that left him physically weakened by the time he was transferred to Nigeria. And so, inside the DSS facility, Kanu reportedly developed a critical potassium deficiency with fluctuating test results that his lawyers say point to inconsistencies in medical reporting. So he claims to have suffered from nosebleeds, fainting spells, chest pains, headaches, and swollen feet, despite over 50 blood tests during his detention. So Kanu credited Emeritus Professor Martin Agaji, a renowned Nigerian surgeon, for stabilizing his condition when eventually he was allowed to intervene. Meanwhile, the Nigerian Medical Association (NMA) has confirmed that it carried out the court-ordered medical evaluation on Nnamdi Kanu. In an interview with Newsmen, the NMA Secretary General Dr. Ben Ebu said the association acted swiftly following the court's directive. The court gave an order that we should do it within 8 days. This is what Ben Ebo is saying now. And so the DSS wrote to them and they assembled a committee of 7 doctors, one from each political zone, covering specialties like ophthalmology, neurology, urology, and gastroenterology. So he confirmed that the team's report had been submitted to the Attorney General of the Federation for review. The Department of State Services could not be reached for comments, and the agency currently has no official spokesperson as at the time this report was filed. And, with growing international attention on Kanu's prolonged detention and now his reported health complications, pressure is mounting on Nigerian authorities to provide transparency, both medically and legally, in a case that has continued to divide opinions across the country and beyond. In my last video, I talked about the political solution that seems to be underway. Could that be the reason why we have been seeing this legal back and forth? Well, here at Political Arena, we connect the dots, break down the facts, and help you make sense of Nigeria's most compelling political stories. If you are here for the first time, do well to subscribe, like, share, and be a part of the conversation in the comments. See you on the next one.